Dr. Chris Nussbaum with Insight Life Care, Concierge Medical Services. This is our internal medicine office here at 500 Vonderburg Drive, Suite 214 in Brandon, Florida. If you take a look over here, you'll see we're complying with the CDC guidance on what to do with the outbreak of coronavirus. We started this up a few weeks ago before the CDC guidance came out because it made perfect sense, and luckily we're right on point. You can also see one of the certificates of many of continuing medical education I'm doing to stay abreast of the coronavirus threat and to make sure we're offering the best possible advice and service to our patients and to people in the community. Insight Life Care is an internal medicine concierge practice, which means we also make house calls. So in the coming days, if people get locked into their homes or are afraid to travel, we can offer that service too. So what's this all about, this coronavirus? I've been getting a lot of phone calls from people saying, hey doc, is this just a big hype or is this something serious? Well, I think most people can see that it's pretty serious now. Many local events have been canceled, as well as national events. The National Hockey League, the NBA, big sporting groups, businesses, Harvard University, state university schools here in Florida, just about everywhere where there might be a lot of people massed together, they have slowed things down to try and create what's known as social distancing. The idea being that to reduce the transmission of this virus, by keeping our distance from one another, we may at least slow down the transmission. The World Health Organization has decided and called it a pandemic. So pretty much in terms of saying, well, we'll stop the transmission in this country, that horses are already out of the barn, and many people will be infected, and unfortunately some will perish. The people that are at most risk are people that would be at risk for influenza or other infections because of immunity problems, people on drugs that reduce their immunity or with known inflammatory diseases, or chemical chemotherapy or radiation for cancer, or people with diabetes or are generally unwell. Those folks should remain home and call for services if they need them. The average individual is probably going to have a very asymptomatic course initially, but may feel sick or feel unwell for a period of time if they get the coronavirus and develop COVID-19. SARS-CoV-2 is the name of the virus that's causing this. It's not that coronaviruses are new. They've been around for a long time and known about, but this one is novel and unusual and highly virulent, very aggressive. COVID-19 is what we call the disease if you get it, and that can result in very severe type of respiratory disease, pneumonia, and even respiratory failure. The idea currently, as being propounded by our director, Dr. Anthony Fauci, is to try and limit the spike of how frequently and how suddenly lots of people get sick. So by creating the social distancing, staying home, avoiding group events, hopefully not that many people will get sick all at once and not overwhelm our healthcare services. If you have a symptom that makes you feel like you might have a cold, or something that surrounds you with the same sort of sense of maybe I have the flu, but I'm not sure, could it be COVID-19? Check and see if you have a temperature, stay home, wash your hands, drink plenty of fluids, and give us a call so we can review the various symptoms that you have and decide whether you might be a person who should have COVID-19 testing. Even though we've heard that there are millions of test kits available, access to these testing kits is not so easy just yet. Right now it comes through the local health department or from your local emergency room. If you go to the emergency room, you'll find that you can't just walk into the waiting area like you once did. Right now, the hospitals, most of them are sealed off, and most major clinics are sealed off so that you can be interviewed outside the hospital and evaluated and isolated rather than coming in and potentially transmitting the disease. The last data that I saw said that for each person that actually has the disease, 2.3 individuals will additionally be infected. You can imagine what happens if those 2.3 go out and infect 2.3 more, and then those additional go out and 2.3 more, and exponentially the disease would spread. I don't think we're going to be able to stop the transmission of this virus, and many of us will have it asymptomatically. We're infected, but we don't actually get COVID-19 disease. That being said, this is an evolving situation with new information coming out all the time. We've seen recently that CAT scans are actually very helpful in determining when someone is very sick with pneumonia, what type of disease they actually have and whether this is COVID-19 or not. There's some initial information that suggests that medications that are used in AIDS or HIV treatment may also be helpful for patients that get very sick. And of course, they're working on a vaccine, but that is definitely months and months away. Hyperimmune globulin from people that have been infected and have recovered may be useful, but again, there's a big distance there. There's a very good chance that you'll get infected, so do your best to remain healthy. Rest, drink plenty of fluids. Remain home if you don't have to actually travel. Many people are wondering about, hey, what do I do? I've got a cruise. Usually most of these companies, the travel companies, cruise lines, airlines, are giving people either vouchers or credit for what they've been doing. And if you have additional questions, feel free to call Insight Life Care, Concierge Medical Centers at 813-689-2961. I'm Dr. Nussbaum, wishing you good health and good luck. Bye.